All right, this relatively short lecture is going to be about the benefits and the risk of physical activity and exercise. So as you can see from this table, which is out of your textbook, gives you an idea of all the research that's gone into looking at the health benefits of physical activity. So without going through every one of these, just a couple of things I want to point out. Things like all-cause mortality, there's definitely a strong relationship between physical activity and reduced risk of all-cause mortality. And another thing I want to point out before I go any further is on this table, it talks about the evidence for a dose-response relationship. A dose-response relationship, basically in the context of physical activity, means that the more physical activity you do, the greater the health benefits. So if you do a certain amount, you get a certain amount of health benefits. If you do more physical activity than that, you get even more benefits. So it's kind of like a dose response of a drug. More drug intake, greater the effect. So same with physical activity. The more physical activity you do, the greater health benefits that arise from that. So you can see for a lot of these where it says yes, that means there's evidence for a dose response relationship, similar to what I just elaborated. So you see all cause mortality, as I pointed out. Cardiorespiratory health, which refers to like basically the health of your cardiovascular pulmonary system. Metabolic health, energy balance. So there's a lot of evidence that physical activity is important and effective at weight maintenance and weight loss. Musculoskeletal health, certain cancers. The cancers that stand out the most are colon cancer and breast cancer, as being definitely a link between physical activity and reduction of risk of those cancers. But there are others listed. It's just the evidence is not quite as strong. And then, as you see for other things like mental health, depression, it's there's likely something there. It's just the evidence isn't quite as strong. But you can clearly see where it's, especially where it says strength of evidence strong, that means there's an overwhelming amount of research out there to show there's a link between physical activity, exercise, and these parameters. And this is a graph from your textbook. I just want to point out I do like this graph because it shows a couple of different things. But one, it shows the clear dose response that I was just talking about. This is focused specifically on atherosclerosis. And they looked at two things. And this is kind of a combination of all the research that's out there. But physical fitness, which we can think of as primarily aerobic fitness, how in shape you are, how greater VO2 max, versus physical activity is generally assessed by just physical activity questionnaires, meaning like people just verbally or on paper say how much physical activity they're doing. So you can see with both. So if we take physical activity first, just the amount of activity that they're doing, the more activity that is done, the lower the risk. And this is specifically risk of cardiovascular disease. Then if you look at fitness, which as I said earlier, primarily refers to how in shape you are, which your aerobic fitness, you can see there's even a greater relationship there. So the more in shape you are, the greater your aerobic fitness, the lower the risk of cardiovascular disease. So you can see actually compare the two. There's a stronger link between fitness and cardiovascular disease versus physical activity and cardiovascular disease. Both are really important, but statistically, the relationship generally appears to be stronger with aerobic fitness and disease. And here's another table I want to just bring up really quickly from your textbook, and it in a more detailed manner outlines the benefits of physical activity on these different health conditions. So cardiovascular and respiratory function, you can see that physical activity and exercise definitely play a role there. Reduction in cardiovascular disease, decreased morbidity and mortality, and then obviously a handful of other benefits that you get from participating in physical activity and exercise. So another kind of topic that's come up over the last decade or so that has been kind of focused on in a lot of research is what we call sedentary behavior. So, in addition to being physically active, the opposite of that would be being sedentary. So, sedentary behavior is generally defined as any behavior that, when you're awake, that's characterized by an energy expenditure less than 1.5 METs. So remember, 1 MET is your resting metabolism. So if you're not doing much more than that, like you're sitting there all day at a desk, or sitting in a chair, lying down, whatever, that's generally referred to as sedentary behavior because your energy expenditure is less than 1.5 METs. So sedentary behavior by itself has also been associated with a lot of health issues, including a lot of the same things we saw earlier, including diabetes, heart disease, various cancers, and all-cause mortality. So a goal for a lot of people is just to reduce their sedentary time sitting there. So if you're sitting there, you have a sedentary job, sitting at a desk, get up and walk around, and you can reduce the sedentary time throughout the day. Other things to consider. So physical activity and exercise by itself, we know it's great. We know there's a lot of benefits from it, but there is obviously some risk. So these risks, I generally like to group into either musculoskeletal risk or cardiovascular risk. And for the most part, as you're going to see as I go through this, that the benefits of physical activity and exercise outweigh the risk. So regarding musculoskeletal risk, generally the risk of musculoskeletal injuries goes up the higher the intensity of exercise. So running versus walking, you're more likely to get injured running. Contact sports, also something that to think about. Injuries tend to go up when you're playing some type of sport that has a lot of contact in it. And as far as the injury sites, they tend to be lower body for the most part. Obviously, that's not going to be 100%, but some of the key parts of the body that are injured during exercise include the knees, the ankle, the feet. So a lot of them are associated, a lot of the injuries are associated with lower body extremities. And one last little note about it, the less fit you are, the greater the risk of musculoskeletal injury. As far as the risk of cardiac events during exercise, overall, the risk of what we call sudden cardiac death and acute myocardial infarction, that's the AMI, and that's just basically referring to a heart attack, the risk is really low if in an apparently healthy population. That means people with no signs or symptoms of disease. And especially if you're performing moderate intensity exercise. So as you're going to see as we go through this semester, there's a big push and focus on moderate intensity physical activity. And one of the reasons is, one, you get a lot of health benefits from that, but also the risk of injury and cardiac events is actually going to be decreased. So the risk, as we said earlier, does increase as intensity increases, but that can be minimized by regularly doing the physical activity. Another factor to consider is the risk is generally higher in older individuals. And also, the cardiovascular risk, anyway, is likely the highest in the during and in the hour immediately following a vigorous exercise bout. So I wanted to point out this graph from your textbook, and it's looking at a study that was done years ago. There's a couple things going on here. I have two studies on this slide. So one done in 1993, and this is a graph from your textbook, just shows that as you do more and more regular physical activity, the risk of, in this case, acute myocardial infarction, which is a heart attack, actually goes down. So if you look at the solid line, so the people that regularly exercised 1 to 2 days a week, their risk was about here. If they up that to 3 to 4 times a week, the risk drops. And if they went up to 5+ times a week, the risk is even lower. And that's a great description of what I was referring to earlier with the dose response. So you do some, like in this case, frequency, you have a certain frequency, there's a certain risk. You increase that frequency of exercise, the risk comes down. You increase it some more, it comes down even more. So that's a nice example of a dose response. The other thing that you can see here is the sedentary group. Obviously, they do not engage in physical activity more than 1 time a week, or they're at 0. So their risk is all the way up here. So long story short, yes, you're at risk when you exercise, but the more regularly you exercise, the lower that risk. So you can bring that risk down to pretty much nothing. Uh, Another study, 1984. I like this one. I always like to bring this one up, but they looked at men who had a cardiac arrest and looked at their physical activity patterns. So in sedentary men, so these are people who are not regularly exercising, the risk of a cardiac arrest during exercise was 56 times greater than the risk they were at when they were sitting on the couch. All right. So if you're sedentary and you go engage in a bout of vigorous exercise, so relatively high intensity exercise in this case, the risk of a cardiac event goes up 56 fold. Compare that to the people who participate in exercise on a regular basis. So those who regularly participated in vigorous exercise, that risk was only 5 times greater. So key point, if you're able to exercise on a regular basis, even though there is some risk of exercising, if you're doing it on a regular basis, the risk comes down dramatically. So the key point, takeaway message here is that the more you exercise, generally the lower the risk in the long haul. Talking about young individuals, sometimes you'll hear on the news about high school or college athletes having cardiovascular events during exercise or playing sports. So there is some risk there. However, in young individuals, the most common risk of cardiac death is going to be in congenital or hereditary abnormalities, meaning that there was something already going on in the cardiovascular system, and it had really nothing to do with exercise, but the exercise kind of caused it to come about. And so there's really no good way to prevent this other than screening. So um, as far as how often this happens, you can see the numbers here. So in men, the numbers that have been published, one in about almost between 62 and 63,000 people, this is going to happen. So the risk is pretty low. If you look at women, it's even lower. So one in about 523,000. So the risk is low. However, it does happen. So this is like I said earlier, the only way to really address this is through screening. So the International Olympic Committee, the American Heart Association have really endorsed health screenings for young athletes to lower the risk of these events. So risk of exercise testing. So one of the things we're going to be doing in this class is we're going to learn how to conduct exercise tests. In this case, I'm referring primarily to graded exercise testing on a bike or a treadmill where you work to your max or a predetermined level and you look at the cardiovascular and metabolic responses. So is there some risk during an exercise test like this? Yes, there is. However, the risk is really low. So the numbers that have been published, 6 events for about 10,000 tests. And so that's a event rate of about 0.06%, which is really, really low. And you got to keep in mind, these numbers include people with disease. So if you don't have any documented disease, the risk is going to be even lower than that. So even though, yes, there's a risk of exercise testing, the risk is relatively low. Cardiac rehabilitation, which are exercise programs for those who have had a heart attack or some other type of cardiovascular event, the risk is also relatively low. If you look at this, one major complication, about 81,000 or so patient hours of exercise, one heart attack or MI, and about 220 patient hours of exercise, one death, and 750 or so patient hours. So as you can see, there is some risk of engaging in exercise and exercise testing. However, compared to the benefits that you get, it's really low. And overall, like I keep saying, the risk of exercise are low, and the benefits that you get are generally going to outweigh those risks. And if we look at how we're doing in the United States anyway, um, if we're going to talk more about the guidelines in addition to what we've already seen, but in the United States, about 51% of the U.S. population are meeting aerobic exercise guidelines. So it's okay. It's not great, but it just gives you an idea of where we are. As far as strength training, about 30% meet those guidelines, so even less. So that tells us that a lot of individuals in the United States are not engaging in muscle strengthening exercise. And then only about 20% meet both aerobic and muscular strength guidelines. So, one of the big things that we're going to talk about this semester is how we address this and how we get more and more people to become physically active so they can also get the benefits that go along with physical activity. And if you like, first bullet point I have up here, globally, if you look at the entire world, about 31% or so are physically inactive. All right, that means sedentary individuals. So that would be a number we would like to address as well. So, conclusion, the risk of exercise and exercise testing are relatively low and in most individuals. And then when proper guidelines are followed and proper screening, we're going to talk about screening before exercise and how we evaluate if somebody's ready to exercise. The benefits of physical activity and exercise substantially outweigh the risk.